Hello guys, today we're going to learn about what is a first aid. Now that we all know that we can get sick or injured, now during these times a person needs immediate help, and this immediate help is what is known as first aid. Now today we're going to learn about what type of first aid to use in what various situations. Now the first one is minor cuts. Now when we all get a cut from, let's just say you were using a knife and you got a cut. Now what should you do? Wash it with cold running tap water and then use antiseptic liquid. Now antiseptic liquid, 1 tablespoon of antiseptic liquid along with water, 1 cup of water is is the solution required to dress the wound. So germs, any germs from the surrounding may want to go into your into your body, and also surrounding the wound there would be many bacteria. To clean off this, we use antiseptic liquid. Use cotton or cloth. Dip the cotton or the cloth into the solution and then dress the wound with it. Now you do the same thing for major cuts as well, but you may skip for minor cuts since they really aren't much of a deal. But please, better off do it. And for major cuts, we should dress the wound as said with antiseptic liquid. But in case the pain is unbearable and the cut is too big, then please take them to the hospital. Next on the list is snake bite. Now a snake bite can happen when, let's just say, you are looking at a snake and you think it's dead. You go and do some problems with it and it's actually alive, because snakes sometimes pretend they're dead and it will come running after you. You run and at some point it cuts, it bites you. Now what do you do in this situation? Uh, Now what you should do is that the victim should not move. The victim should not move and all clothes must be loosened off and taken off. Now what should you do next? Take a cloth or a bandage and tie the wound very tightly around the infective area. Tie it very tightly. Why? To stop the flow of venom. Now venom can flow through the veins and arise for serious problems. So to stop it, we need to tie the bandage very tightly so no venom may flow and maybe get to the brain and do problems. I really don't know what snake venom does. And then rush that person to the hospital and get him or her an anti venom injection. So they'll be saved. Next off is sprain. I know this thing does not look much as like someone got sprained, but this red area over here is a sprain, like the infected area. And I don't know, this is not that pleasing or promising, but I couldn't get anything for sprains. So when a sprain happens, it's when a part of the body is twisted. Now when it's twisted, what we should do is apply ice pack or ice cubes around the wound, around the sprain, and then on the sprain, and then tie it up with a crepe bandage or a bandage. Yeah, tie it up with a bandage or a crepe bandage. So next up is bee stings. Now when it comes to bee stings, what we need to do is that to take off the stinger and take off. Please take off the stinger. And why should we take off the stinger? Because when a bee stings, its venom sac will still keep on pumping venom. So we don't want that to happen. So in order for that to not happen, use a tweezer and remove the stinger. First remove the stinger. Then wash the wound with soap and water. Now you can honestly use soap and water to even wash your wounds. That's actually what first aid. That's what doctors say recommend. You don't need to use alcohol though. Please don't use alcohol. You may use antiseptic liquid or better off go with soap in case you have it. Now you should wash the wound with soap and water, and then you should apply ice cubes to reduce the swelling. So to reduce the swelling, we use ice cubes. Now next on our list is a fracture. Now when a person gets a fracture, tie it around with a cardboard or a piece of cloth. Now better off use magazines which are perfect. for these situations, which this is called a splint, and a splint helps the, I mean, it keeps the bone from moving. Now then use something like a rope to act as a sling. Now we've all seen people with slings and those cloth, yeah, something like that. Yeah, so make it similar to that. You have to use a sling and a splint. That's the first aid you give for a fractured person. The same thing even goes for legs, and it's quite a stupid design. I don't know why do they invent it. But anyway, going next would be the rusted cut. Now, when it comes to rusted cuts, what we should do is wash the wound and then apply ointment. And if you have not gotten a tetanus vaccine, vaccination or anti-tetanus shot yet, go and get one this instant after you get the cut. After getting the cut, rush the person to the doctor. After applying the ointment and doing the first aid, rush the person to the doctor and get him or her an anti-tetanus shot, or else there will be serious complications. Now, lastly, I'd like to say is CPR. Now, CPR is actually what we do for when a person does not have, when a person faints and does not have a heartbeat. Now, when a person does not have heartbeat, or the heart is not beating, the person has fainted. Now, what should you do, and why should we do this CPR? Now, when we do the CPR, we need to keep both of our hands on the person's chest and apply pressure periodically for 30 counts and give 2 blows. Now, why are we doing the 30 pumps? Now, this is why. Okay. Now, the heart pumps blood. We all know that. Now, while now the heart is not pumping blood, so we are doing the heart's action instead of us. Instead of the heart, we are doing the heart's action. What does the heart do? Pump blood. What are we doing? Giving chest pump. We're applying pressure. Now, this pressure is like pumping, and the heart is like pumping the blood via our pumping action. This can make blood flow to the brain, and somehow the brain can get its blood, and it can uh, well, what you know, and the person can become conscious again. So this is the science behind CPR. And when you do it for a baby, please do not use your both of your hands. You may do that for a child or for a person or for a adult, but when it comes to a baby, use two of your fingers and periodically apply the pressure. Don't use both of your hands when it comes to this. Now, one last thing I forgot to put in the slide is that rabies and dog bites. Now, when you get bitten by an animal, what you should do is, as per, just cover the, wash the wound, apply some ointment or I think the antiseptic liquid, and then immediately rush to the doctor, get a anti-rabies injection. Now, rabies is a great monster, and after symptoms of rabies show up, you are literally doomed. And don't worry,